And you are live.
Hey everybody, this is Art. Thank you so much for joining us. We're on this important conversation, this important conversation on healthcare and access to healthcare and its affordability. I am so glad that we can have this important conversation as there have been many changes to access to healthcare as a result of the new administration in Washington, D.C. and that Congress. I'm very thrilled. I'm excited to have Devon Trolley. She is the executive director of Pennie. Pennie is the Pennsylvania Healthcare Exchange that provides affordable healthcare for those who have a moderate incomes. And then I also have Erin Gabriel. She's with the Pennsylvania Health Access Network, also called FON, and she's over the government relations. And we've had a number of conversations with these fantastic individuals over time to help us understand what are happening. Now, Devin and Erin will each have about 15 minutes of presentation where they'll talk about some of the changes to Pennie and to Medicaid and to other dynamics that are changing healthcare access here in Pennsylvania. Now, once they've concluded their remarks, I will ask a few questions and invite my colleagues to ask questions as well. I see on camera my good friend Tim Carney. Tim, thanks so much for joining. Thanks so much for joining. Erin, let me know if other senators join as well so we can recognize them in case I do not see them on my screen. So I think that is a good kind of introduction. If I ask folks to please stay on mute, I will go on mute as well when speakers are making presentations. That'll make it much easier for us to hear them. So with that basic framework, I think I should share one other big background feature. I am the Democratic chair of the Health and Human Services Committee in the Pennsylvania State Senate. And so we have some responsibility as well as duty to keep members aware of changes that are happening, as well as to advocate so that each person has access to health care. Personally, it's my firm belief that health care is a human right. It is a matter of human dignity that individuals have access to health care. I have been and continue to be an advocate for universal care so everybody is covered. And I'll share one quick story before I turn it over to Devon. Many years ago, I was a student at the University of London, and in my second year of, no, my third year of college. And I had an unfortunate experience. I had a bad toothache. And, toothaches can be very painful. This one was very painful. And so I talked to a friend of mine. I said, hey, what can I do? How can I get some treatment for my tooth? And he said, no problem. You should go over to a dentist, which I did. They arranged my way. I went to the dentist. He gave me a root canal, which amazingly was not painful at all. But the core of the story is that when I finished the root canal and got the care, there was zero coverage. I said, how much do I owe you? They said, nothing. It's already covered. This is universal care. It's in England, it's in Canada, it's in Japan, it's in Germany, it's in Spain, it's in France. All the countries that are really comparable to the United States have universal care. And I get so disgusted when Americans compare us to, they say we're better than Brazil or um, Egypt. I mean, these are underdeveloped countries. They can't compare to the United States. Now, some of these countries, however, do have universal care. And the last thing I wanted to share on this conversation was a meeting I had in my office last week with individuals who are coming from across the United States to look at state policies. And there was a question I raised to those who were present. In fact, one of the people who were present had been in China. Another had been in Canada. And there was, I made the statement about the importance of universal care. And they said, well, healthcare can be slower there than here in the United States. So I raised the question, how long would it take to get a root canal appointment in Canada? I think the answer was 10 days. I said, how long would it take to get one in the United States? Several weeks. And so if it's not an emergency, the universal care systems are providing more quick access to service than here in the United States. It takes me at least 6 weeks to get a 6 to 8 weeks to get a physical appointment. So, having said that, I'm not trying to trash the American system, but we have some serious challenges. And so I now want to turn it over to Devon Trolley, Executive Director of Pennie, to give us her remarks on where we are today. Devon, thanks so much. Take it away.
Thanks, Senator Haywood, for having this opportunity to talk through the changes that we have been seeing at Pennie. And for the Senator did a great job of teeing up what Pennie is. We are the official health insurance marketplace for Pennsylvania. And that really means that we offer high quality and try to be as affordable as possible for people who don't have coverage from any other source. So if people don't have coverage through their job or through Medicaid or through Medicare, Pennie is the best place for them to go to make sure that they have high quality coverage that has a maximum consumer protections and offers a wide range of essential health benefits. And we are the only place to get federal premium tax credits that instantly lower the cost of coverage, making it more affordable. These tax credits are based on income. And as I'll talk about, there have been significant changes to these tax credits over the past several months for 2026 coverage. And we are seeing a lot of impacts of those federal changes on Pennsylvanians' ability to afford coverage. Just tying into some of the comments that Senator Haywood made at the end there about universal coverage, the health insurance marketplace was really intended under the Affordable Care Act in conjunction with Medicaid expansion to be the way to allow everyone access to affordable coverage. Now, as we've seen that implemented, and there have been various changes to Medicaid and to the marketplace, there are currently challenges with both of those programs in achieving that goal, but that really was the original intent, was that the marketplace was a key aspect of trying to make sure that everyone could have access to coverage. So I'll talk a little bit about where we are right now with enrollment and some of what those federal changes have meant for us in these past several months. Before I do, I just also want to mention that many of who we serve are people across Pennsylvania. As I mentioned, it's people who don't have access to other coverage. So what that means is it's often small business owners or employees of small businesses who are not able to afford to provide coverage to their workers. It's part-time workers or gig workers, farmers, early retirees who are not yet eligible for Medicare, and many others, but wanted to give a little bit of flavor of who we're talking about before we jump into the impacts, as all of these groups have been impacted over the past several months. So we have been through a year of major change with more changes coming. Several policy changes at the federal level have impacted the Affordable Care Act and marketplace coverage, and the impact has been immediate. After years of sustained growth and a visible reduction in the uninsured rate in Pennsylvania, the trends are now going in the opposite direction. We have seen many Pennsylvanians drop their 2026 coverage due to a significant jump in prices because of federal policy changes. We hear constantly from Pennsylvanians, as I'm sure many of you do as well, from your friends and neighbors, about the need for more affordable coverage. However, these federal changes have led to more costs and more barriers to getting coverage. The main driver at this point is because the amount of premium tax credits, and again, those premium tax credits are what help lower the cost of coverage so that people can enroll in the first place. The amount of those premium tax credits was reduced by the federal government. So that means less of the health insurance cost was covered by the tax credit, meaning Pennsylvanians have less help to afford coverage. What this meant is that people who were enrolled in Pennie in 2025 saw their costs double to stay in the same plan for 2026. A little bit more background. There were tax credits put in place in the original Affordable Care Act after years of that helping enrollment. There was a recognition that those tax credits were not generous enough to really achieve the goal of making sure everyone had affordable health insurance. So in 2021, those premium tax credits were expanded to be more generous and to cover all income levels so that no one pays more than 10% of their income towards health insurance. That really just helped more middle income Pennsylvanians afford coverage. Those tax credits, the expanded part, expired at the end of 2025, and that is why there has been a significant change in enrollment. When we had those 5 years of extra affordability, the dynamics we saw were really interesting. The groups that were disproportionately uninsured, so rural populations, minority populations, Black and Hispanic populations, um, and young adults who often go uninsured, all of those who had higher uninsured rates enrolled at faster rates than everyone else in Pennsylvania. So that extra affordability was really very clearly effective at expanding access to coverage for a lot of vulnerable populations. Unfortunately, what we've seen now that those extra tax credits have expired is backtracking of those enrollments for many of those populations. Some of the largest numbers, as I'll get into in a minute, that we've seen of people dropping coverage, for example, have been in rural areas. They were some of the hardest hit this year with these price increases. With that expanded tax credit, we hit record levels of enrollment, peaking at around 500,000 Pennsylvanians who had coverage through Pennie last year. And we have seen significant reductions to that as well. So let's talk about the numbers a little bit. During open enrollment, again, with these cost increases, we saw pretty immediate impacts. We saw about 1,000 people, Pennsylvanians, a day drop coverage. So that's Pennsylvanians. Those were one of the 500,000 who had coverage in 2025. About 1,000 dropped that coverage every single day throughout open enrollment because of those cost increases. We also saw not just people dropping coverage, but people buying to other levels of coverage. There's different levels of coverage. You have platinum, bronze to platinum. Platinum is the highest level. It means it has the lowest deductibles, lowest out-of-pocket costs, can have higher premiums. And then you kind of have these different levels that are really a trade-off between lowering the premium, but increasing copays and deductibles. So what we have seen with the enhanced tax credits is that people were able to buy up to more generous coverage, meaning that they had lower deductibles, lower copays when they went to the doctor, kind of reducing those barriers to care that many people feel. What we saw is a reversal on that as well. So many people during open enrollment went from maybe a gold down to a bronze. So that means they might be paying the same monthly premium or still even a higher premium, but the biggest change is they're now paying thousands of dollars more a year in medical costs when they go to the doctor. And what we've heard from people and what the research has shown again and again is that when people have really high deductibles and really high copays, they don't get care. It's a phenomenon of called underinsured, where you technically have insurance, but for many people, it's not really providing them what they need to be able to get preventive care or manage chronic conditions, or really prevent them from waiting until the last minute to get care, which often leads to emergency room visits. And again, we've heard that we've seen that in the data, we've seen this before. That was sort of one of the drivers to the Affordable Care Act trying to address the uninsured issue. But we've also heard it directly from so many Pennsylvanians during open enrollment of, I have to stay covered. I'm going to make it work. I'm going to buy the only plan I can afford. But looking at that $7,000 deductible when I only make $30,000 a year, I know I can tell you I'm not going to get care unless I'm in an emergency situation and absolutely need it. And that's really not what promotes the most health among Pennsylvanians. And unfortunately, people know that and they want to be able to have lower costs, but oftentimes, again, those plans are just not available given the lowering of the premium tax credits. So where are we right now? So we had seen, you might have seen that we had about 85,000 people in total drop 2026 coverage coming out of open enrollment at the end of January. That number has only gotten worse. We are now at about 140,000 people who had coverage in 2025 who no longer have coverage in 2026 through Pennie. Now, some portion of that may go to other coverage, employer coverage, Medicare. We see that every year, but this number is so much higher in terms of the number of people who've dropped than any other year. That many of those people we know because we've done surveys, we've talked to them, they've explained why they're dropping coverage. Many of them are going uninsured. And when you have more uninsured people, that really has a broader impact on Pennsylvania. Some people we talk to are like, well, that's unfortunate, but it kind of only impacts them, right? And it doesn't. It does have a broader impact on our healthcare system and our economy. And again, what's unfortunate is we've seen this movie before, right? The uninsured rates and the negative consequences of that was really, again, what was trying to drive towards the Affordable Care Act and get these affordable quality coverage options in place. So let's talk a little bit about that. When people go uninsured, what we know is that they don't seek care for problems to address them early on. They wait. So maybe a heart condition that could have been solved through a prescription, a pretty affordable prescription, is not addressed and now becomes a catastrophic heart failure that needs to be emergency room surgery, all of those pieces to save a person's life at that late stage. And typically, if that person's uninsured, that could become and oftentimes becomes uncompensated care for the hospital. So they're taking a person who had coverage through Pennie potentially, right, with private reimbursement rates, which tend to be some of the higher reimbursement rates for providers. Now you're shifting them to uncompensated care, which is care that hospitals don't always get backfilled or are backfilled at much lower rates. As we know, there are a lot of very vulnerable hospitals in Pennsylvania, very financially strained hospitals, and even small differences in shifting people from generous private coverage to uncompensated care uninsured can have a really significant impact on hospital finances. What we've also heard directly from people who are enrolled through Pennie coverage, and again, this proves out in the data as well, is that people are less healthy when they are uninsured or underinsured, when they're not seeking care to manage those conditions. And when that happens, we've heard from some consumers who are very scared that they, without care, will not be able to work anymore because they won't be able to manage their health condition and they may not be physically able to work. So now you're taking people who are currently thriving, doing work they love, healthy enough to do that work, and without access to healthcare, they're being shifted into not being physically able to work, potentially going on disability, and not being able to pursue their own dreams, but also not being able to be, in the financial independence that they want to be, and being able to really be productive and helping the Pennsylvania economy be strong. So really in that way, the uninsured, what we're concerned about in terms of the numbers we've seen of people dropping, and again, it's about 140,000 of the 500,000 that were enrolled in 2025 have now dropped coverage through Pennie. What we are really concerned about there is the impact on those individuals specifically and not being able to access medical care. And, we've heard a lot of fear from people about what to do. We've heard people say that they're not taking their kids to trampoline parks, or they're not going out and playing sports with their friends because they're worried about getting injured and sort of living more that life of fear, of not wanting to take those risks physically, lest they get injured. But we are also concerned about it from that overall level of the healthcare system in general, which impacts everybody. If there's more people going to the emergency rooms, that means for everyone who needs the emergency room, it's going to be harder. Those services are going to be more strained. And then again, that economic impact of having people able to work. One other group that we hear often from is small business owners. They already feel at a disadvantage and sometimes not being able to provide health insurance. And many small business employees get their health insurance through Pennie because it is an affordable option. But as Pennie options become less affordable, small business owners have a harder time finding workers, recruiting workers to work for them if they cannot offer or if there are no affordable options for their employees. So that is also a dynamic. Many of the businesses in Pennsylvania are small businesses. And so we hear that again and again from small business owners wondering about even their own health insurance coverage and the price of it going up, if they're able to hire that person, or if they should hold back on hiring that person, or if they have to increase the cost of their goods and services and push that out to local economies through price increases in order just to cover the thousands of dollars more they're paying for coverage in a year. So I wanted to really draw into really put some more context around those numbers just because we've heard so much from Pennsylvanians directly and wanted to share what we've heard with all of you today. And I think the last part, just to mention, is that we do there are still premium tax credits available. They're just not as rich. So that means some people can still enroll, which is great. We want everyone who can to enroll and have that peace of mind. So for those of you who might be hearing from your constituents or hearing from friends and family, Pennie is still a great place to start. It is the only place to go to get high quality coverage where you know you have the full benefits and maximum consumer protections, and the only place to get those tax credits for people who still qualify. So just want to underscore that we are still striving to reach as many people as possible to make sure they are aware of Pennie, but sort of all the time knowing that it is a smaller population that can now afford coverage through Pennie, and unfortunately, people not in that population are going uninsured with all of the risks I mentioned. It's also just worth noting that there are additional federal changes coming up this coming year and the year after that will make some people ineligible for tax credits and also add additional administrative barriers to enrolling, requiring people to do extra steps to enroll. From Pennie's perspective, we're going to try to make that as seamless as possible, but there are extra steps that people have to take. So just wanted to flag that we'll be providing a lot more information about what those changes mean. We are really trying to make sure that at least on the administrative steps, that we are hoping to keep as many people enrolled as possible, even with those in terms of federal changes making some people ineligible. And those really have to do with certain lawfully present individuals who have lawful present statuses, but those statuses have been determined no longer to be eligible. So there are some additional concerns about eligibility and uninsured. I mean, the bottom line is that people don't stop getting sick just because they don't have coverage. So if they're not eligible for coverage, they can't find affordable coverage, it's not like this problem goes away. We all collectively will be faced with it in one way or another. So I think that's just something as we kind of see these different impacts playing out to keep in mind. So those are the key items I wanted to mention. I think for anyone who is looking for that coverage who might still be eligible, and there are still a lot of people who are eligible, just again, not as many, and really kind of backtracking on the progress we've been making. But we do have a lot of resources to help. We have a call center, we have a website with a lot of information and FAQs. We also have health insurance brokers who are certified with us throughout the state to help people through the enrollment and application process. And you'll hear from one of the groups that provides a lot of assister services as well in just a minute. And we have actually expanded the number of assisters that we have across the state, and those are really, often in nonprofit organizations or health centers around the state that can offer assistance. So just also wanted to make sure that people know that Pennie's always here to help, and we are really looking to support people who are trying to explore their options for coverage. So thank you.
Thank you so much for that presentation. Before we go to Erin, I got a few really quick questions just for clarification. You referred to the expired tax credits that were making things more affordable. I just want to highlight there was an opportunity to renew these tax credits so they would not expire. And of course, there was a big fight in the national government about whether to extend or not extend. But I do want to clarify that this was a big opportunity to extend these tax credits, a fight in Congress over it. We lost that fight, but that's what the expiration meant. We lost the fight for extension. So I did want to highlight that. The other thing, the tax credit. How would you explain the tax credit to an everyday person?
Sure. So it is sort of a different tax credit. Most tax credits you get when you file your taxes and you get that credit at tax time. This tax credit that you get through Pennie is different. You get it on the spot to lower health insurance premiums. So instead of a health insurance premium maybe being $600 a month, many Pennie enrollees pay $10 a month or $100 a month for that same exact plan. And what you pay is based on what you make. So people who have lower incomes pay less for their health insurance, and people who have higher incomes contribute more to those monthly premiums. So it's a sliding scale and really dependent on income, really intended to recognize that different income levels have different space in their budget to be able to pay for health insurance. And so it really provides that sliding scale.
Yes, and I've met some people in my district who are paying $0 for their coverage, and some paying 40 or 100, but so much less than they would have had to pay on the private market. So the tax credit means your monthly payment is significantly lower and therefore more affordable. The last question I wanted for clarification was uncompensated care. Now, my understanding is that basically means the hospital pays because the care's got to be provided. The hospital is required to provide care. The national law that requires them to do so, as well as some oath that they take just to protect people. And so uncompensated care means the hospital's not getting paid and they're doing those services for free. And I've shared with a number of my neighbors that when a hospital does hospital care for free, somebody pays. It's not like it's not paid for. And so the hospitals may end up charging people who can pay more to make up for the people who cannot pay. Okay, having said that, is there anything that I misspoke on that, Devon? Was my summary accurate or inaccurate?
Oh, I think that was a great summary.
Okay, let's try to break it down for folks to some extent. Now I want to turn it over to Erin, who's a fan, and Erin, take it away.
Well, thank you, Senator, and thank you everybody for being here. I see a lot of familiar names on the Zoom, a lot of Senator's staff, and I appreciate you guys all being here and taking the time this morning to talk more about healthcare. I'm going to try not to rehash things that Devon's already talked about. As you all know, there have been a lot of recent federal changes to our healthcare system in general between the Affordable Care Marketplace and Medicaid, in fact, through over the last year. So what Devon was speaking to is obviously we've had a lot of changes with the expiration of those EPTCs, those tax credits, those additional tax credits that were put in place in 2021. There are still tax credits available for people in lower income. So I don't want people to be afraid to go look and go shop. If you are in a situation where you are having like a change of coverage, and you are in one of those special enrollment periods, as they say, like if you've changed your job or lost your insurance for another reason, please go look at the Pennie Marketplace because there's a good chance that you may be able to still find something that works for you. And while you're looking, if you are having kind of any issues or you are looking for a plan, or even if you're looking to apply for something like Medicaid, you can call FANS hotline, or you can pass this on to your constituents. I know we have a lot of staff here. Our hotline is 877-570-3642, and you can find that on our website as well, pahealthaccess.org. Folks can call or text that phone number, and a real human will respond to them, and we can help you, figure out what plan might work for you. If you might qualify for one of the many Medicaid programs out there, we can help you apply for that as well. So I don't want folks to think that, all hope is lost and they just have to go without. please keep shopping. Please keep reaching out because there's a good chance we might be able to find a way through this together. So the Pennsylvania Health Access Network is Pennsylvania's only statewide patient-driven organization. We are working to expand and protect access to high-quality, equitable, affordable health care for all Pennsylvanians. And what that means is we are advocating for patients. So we don't necessarily advocate for the insurance companies or the hospitals or the pharmaceutical companies, although a lot of times, those goals do align because we are all trying to get patients healthy, but we are the ones out there talking from the patient perspective. So when we're looking at things like Medicaid and the Affordable Care Act, we're advocating at both the state and federal level. And, I think what we saw last year was something of an attempt at a silent repeal of the ACA. Of course, Congress has in the past kind of toyed with the idea of repealing the Affordable Care Act altogether, but what they've basically been doing is cutting back on the number of people using the Affordable Care Act. The Affordable Care and Patient Protection and Affordable Care Act is twofold. It is patient protections, which I know a lot of you know all about, protections for pre-existing conditions, caps, no, a ban on caps on lifetime care and annual dollar amount care, but also the affordability aspect of this, which is, as we are seeing, this repeal of these or the expiration of these EPTCs has really been dramatic for a lot of families. We are seeing in some of our more rural parts of Pennsylvania, premiums for a 55-year-old couple making $89,000 a year, which is the median income in Pennsylvania. For some plans are going from $500 a month to $2,500 a month. That's a month, not a year. Like I looked at it, I was like, that's got to be an annual premium. There's no way. So I mean, that's more than most folks' mortgage. And now they're being asked to pay that per month for their health care. And some people really don't have a choice. So what we're seeing is the folks who are dropping coverage are the folks who are kind of taking that gamble that they won't get sick this year. And the folks who are keeping or buying their coverage are the ones who know they're going to use it. So by definition, that risk pool is less healthy, meaning that the insurance companies are then paying more to take care of those people who are buying the insurance, who are using it because they tend to be, have more health issues. They might be older, they might have chronic conditions, which then drives up the costs for the insurance companies. And what do the insurance companies do when the costs go up? They have to pass that on to everybody else. So the insurance rates kind of keep creeping up. And that's important because it affects everybody. I know, like, for myself, I don't get my insurance through the marketplace. I get it through my husband's workplace. So the employer-sponsored health insurance is getting more expensive because insurance companies are shelling out more money for people who are using it more. And also when we are seeing, this increase in uncompensated care that Devon was talking about, we're seeing hospitals having to cover more care that is not being paid for. We're seeing an increase in medical debt. We're seeing an increase in uncompensated care. Hospitals have to make their ends meet, so they have to end up kind of raising the cost of everybody else's care to kind of cover their overall costs, which again, for those of us that have insurance, the insurance is then paying a higher rate. And again, those prices keep creeping up. So I think a lot of folks were looking at this like, I don't get my plan through the marketplace, so I don't need to worry about it. That's not true. If you get your plan through anywhere, all the prices are going to go up because what we are seeing is like this snowball effect. So it really is one of those issues that affects absolutely everybody, whether or not you get a subsidy, whether or not you get your plan through the marketplace, your costs are going to go up. And what we are seeing right now is, as people are kind of adjusting to this new reality and these prices, they may have optimistically purchased a plan at the end of 2025, thinking that, maybe the tax credits will come back, or maybe I will find a way to afford this. But as the bill comes due, they are more and more of them are saying, I just can't afford this, and they're dropping. So we've already seen, as Devon said, 140,000 Pennsylvanians drop their coverage. We expect to see a lot more. We are going to be going through some changes in the enrollment process in the fall, which is again why I encourage you to let your constituents know that we have a helpline. We can help folks through this. But we are looking at a shortened enrollment period. We are looking at previously folks could kind of auto renew. That, if you did nothing, your plan would just sort of renew. That's no longer going to happen. So you really do have to get in the habit of getting back onto the website and updating everything and looking at new plans and making sure that you are being enrolled in a plan. So without that, a lot of people are just gonna, the fall is busy. It's back to school, it's Halloween, it's Thanksgiving, it's Christmas. People forget. And as people forget, they're going to lose their health coverage. So we're actually expecting to see that number that's right now at 140,000 folks losing their coverage. We may see that creep closer to 250,000 people dropping off of their Pennie marketplace coverage because of the combination of cost and the changes in the enrollment process. So again, really encouraging folks to plan ahead, get your papers ready. There's going to be a lot of extra verification that folks will have to go through. So making sure that, again, like if you got married and you changed your name, that you have that proof there. All that kind of stuff, really just making sure you have all your ducks in a row ahead of time, because it will be a shortened period to apply and it will be a little bit more difficult than it has been. So that's what's going on with the Pennie marketplace. I think a lot of you have also heard that we've had some changes to Medicaid. So starting next year, we will have what's called work reporting requirements. And this is specifically for that Medicaid expansion population. So the Medicaid expansion population, a lot of these folks don't know that they're Medicaid expansion. They're going to be getting notices in the mail. But these are folks who are not, these are not wealthy folks. These are people like somebody making $18,000 a year is probably on Medicaid expansion. So this is, somebody who's working enough to make a little bit, but still needs some help. And these work reporting requirements will come due every 6 months, and they will have to prove that they were working a certain number of hours each week, or volunteering, or otherwise exempt. These exemptions are not actual exemptions. I mean, the way that work reporting requirements have worked in other states is a lot of people get lost through the paperwork process. These are often people with disabilities that maybe aren't disabled enough to qualify as disabled for Medicaid. These are people who are caring for a loved one with disabilities. These are people who are in school or in some sort of job training, people who are ill, or people who are actually already working. So 64% of people on Medicaid are already working. And we all just went through tax season. Congratulations if you survived tax season. So we all know how much fun it is to fill out government paperwork and get all your stuff together and ship it off to somebody and hope it gets there in time. That is what folks who are already struggling, already caring for a loved one who has disabilities, already in school, already taking care of kids, already working, are going to have to do now twice a year in addition to their taxes. So it's a lot of extra paperwork for those folks, but it's also a lot of extra paperwork to be processed by the state, by the county assistance offices. So many of you as staff may have constituents come to you and say, "Hey, I'm really having trouble like getting this paperwork done. Can you help me out?" Prepare to have a lot more of that because it's going to be a lot more delays. It's going to be a lot more confusion, a lot more paperwork, and people are going to get dropped off of Medicaid that shouldn't be dropped off of Medicaid. And then we worry that, do they come back and reapply, or do they just not have insurance and show up as uncompensated care, or they may have, a chronic illness that gets worse because they're not taking care of it because they no longer have insurance. So there's a lot going on that is really impacting everybody. I mean, I think what's often lost in these conversations is that these are changes that don't just impact people on Medicaid. These are changes that don't just impact people on the marketplace. These are changes that will impact absolutely every single person in this state because everybody has to access healthcare somehow, and everybody's costs are going to go up. So, things that we're asking folks to do is obviously to talk to their legislators. We're asking for the state legislature to really pay attention to, the state budget is about to be very dramatically impacted by the changes in Medicaid. We're talking about $4 billion a year out of the annual budget. So we're really concerned that, there are a lot of special Medicaid programs that could be, targeted, for lack of a better word, for to make up some of these cuts. These are programs that, frankly, keep people alive. These are programs that, waivers for home and community-based services, for example, programs for kids with disabilities. All these kinds of programs are funded through the Medicaid budget and could potentially be at risk as we start to see that money pull away. So making sure that when you're making these decisions as senators, and if there's constituents watching, that you are talking to your legislators about these issues, that we are not hurting our most vulnerable populations by trying to balance this very unbalanced budget that is coming on the backs of our most vulnerable. And I know that that's going to be, that's going to be really, really hard. I know that there are some hard decisions coming. So the other thing that we're asking folks to do is to talk to their federal legislators to see if there are ways to reverse some or all of these cuts. I think there's a lot of concern that this is really putting far too much burden on state budgets, and that so much money is being pulled out of the state budgets for Medicaid and for the affordable care marketplaces that it's not going to be something that at the state level we can really fully make up. So trying to talk more to our federal legislators about other things we could do to reduce costs that wouldn't hurt patients. So, there's a lot of policies. If you've seen me around the building, I've probably been talking to you about things like hospital price transparency or, all these different policies that can kind of start to save money at the cost level that wouldn't hurt patients and could actually help patients. And some of that money that we're pulling out of Medicaid could be made up that way at the federal level with some of these policies. So I think that's about, I don't want to take up the whole morning here, but do you have any questions for me? I'm happy to chat.
Thank you so much for your fantastic presentation. Before I open it up to others, I do have a few questions. And if you have a question, maybe put it in the chat or raise your hand or something like that so we can get to it and get some orderliness to additional questions. But the more verification.
Mhm.
Could you talk a little bit more about what more verification means? This is particularly for my neighbors in the 4th Senate District who will also hopefully be watching and listening to this presentation. What is some of the more verification that folks may need in order to maintain coverage?
Sure. So I think one of the things that I think has been pretty well advertised anyway, are some of the verifications that they were talking about for the SAVE Act, proving that you're a citizen in order to vote. A lot of the same verifications might be required to prove that you're a citizen to get insurance. There are some changes coming, and some of them have already been implemented actually, with lawfully present immigrants with low incomes as of January 2026. They're no longer eligible for any of the tax credits. And starting in January 2027, there's only going to be 3 groups of immigrants that will be eligible for those tax credits. Those will be green card holders, Cuban and Haitian entrants, and COFA migrants, which is migrants from a certain part of I think it's Malaysia. But in order to access those tax credits, there's going to be some kind of citizenship kind of verification there. And again, if you're proactive, if you talk to us ahead of time and you know, we can walk you through that. So I would really encourage people. I am not a Penny assister. I'm the government affairs person. We have much, much smarter people than me working on those phone lines. So I always tell people to please just call our helpline, which is 877 570 3642. And this is a great time of year to be calling and talking to folks about that because they're not like overwhelmed with all the, you know, enrollment stuff right now. So it's a good time to have those conversations now to kind of get your papers in order so that when the time comes, you've already got your little packet ready to go. And again, you can call or text that line. I know some folks prefer to text, so that's an option for folks as well.
That's really helpful. A couple other ones. The no automatic renewal.
Mm.
So um, I don't know if anyone has any information on what the impact might be, like how many people did automatically renew and therefore got into the habit of it. I mean, this whole automatic renewal, I can see, as you have said, a number of people missing it because
Yeah.
they think it already happened because of the, you know, because of the history of automatic renewal. Any more information on that that we can share with people? Maybe some kind of notice, but this is the first time I heard that, so I'm so glad you shared it.
Yeah, and I think that that's in my mind that like for me because I'm a mom of three, I just think of you know what that time of the year is like, you know, to have one more thing added on. And so I think you know it's just people are just going to have to hopefully all of you as senators can be letting your constituents know like, hey, if you're on Penny, make sure you check in, make sure you know check out that website because you know it is it's just such a busy time of year. I mean we're back to school we got and I know I keep saying Halloween but Halloween's a busy time. You know I know there's elections for people who are involved in that. I know a lot of your staff might be involved in that as well. Of course you've got Thanksgiving, Hanukkah, Christmas, you know, it's just such a crazy time. I think it's really important that people kind of stay aware of that. Maybe, you know, in August, check in, make sure that you're ready, know what kind of plan you might be able to afford. Usually those rates come out. Devon probably obviously knows more about this than I do, but they start to release those rates kind of like as a preview for window shopping in the early fall, so you can kind of look and see what's available. But yeah, it's that's going to catch a lot of people off guard, I think. Devin, you
Yeah.
probably have numbers and stuff, so I'll let you speak more to that.
Yeah, thank you. I'll just add a couple of pieces. So, one, just clarification, we can automatically renew for one more year. So this coming year, we will be able to automatically renew people, but next year, every single person who has coverage through Penny will need to come in, actively confirm that all of their information is still accurate. And I want to be clear, we already verify that that information is accurate with data sources like the IRS income data source and with Social Security Administration regarding citizenship. So we already do a lot of verifications, but the new requirement is that people come in directly to verify. And only until they do that, and only if they do that, will we be able to continue their tax credits for the following year. That will be a major change. I think everyone who think of your car insurance, if you've had employer coverage before, if you don't do anything, it just automatically rolls over. That's what people are used to. And so we do think it'll be a very significant change for people. And potentially, what the risk is that people will miss that they have to do that and then lose the tax credits and then not be able to afford coverage anymore. So from Penny's perspective, we are trying to get people in the mode of coming back every year. So even though we can still automatically renew people this coming year and in a few months here, we still want every single person to come back because it's so important just to get in that practice. Open enrollment is the time. Even if you don't think anything has changed, come back in and just make sure, just double check, get in the practice of doing that because next year If you don't, that will have really huge consequences for people.
Wow, that's a mess. So thanks so much for sharing that and having an approach to try to get people ready a year ahead of time. The last question I had before I open it up is it was mentioned that the period will be shorter for opportunity to enroll. And is that 27 or 28 or and what would the period actually be?
Yeah, great. That's a this year change, so it's a great point to highlight. So another federal change is that they con restricted how long open enrollment can be. So ever since Penny began, it's been November 1st to January 15th. And we found that really gives people a good amount of time to look at their plans. Sometimes people are automatically renewed and they realize that in January and they realize they want to make a change. There's a couple weeks there where they can make a change before it's too late. However, because of the federal rules, we can't go into January anymore and it has to be shorter. So we are going to start October 15th, which is the earliest we've ever started. So that's going to be a new date for this year. And the really, really important thing is that December 15th is the only one and only deadline for coverage. So if you miss December 15th, it used to be that you would have a few more weeks into January, no longer the case. If people missed it December 15th, they'll be locked out of coverage until the entire next year. So we're going to be doing a lot of messaging on that. We'll be really looking to every stakeholder and every person possible who can help shout that from the rooftops with us. But that is going to be a very important date and deadline for people. There's just people have learned that they have more time and they take the time, and there's a big risk there that people are not going to realize that that is the only deadline for this year when they're looking for 2027 coverage. So that'll take effect in just 6 months, less than 6 months, 5.5 months here.
Yeah, I strongly agree with you and everything you all said, but December 15th is not like a natural deadline for people. It's not the end of the month, which is kind of like a natural deadline. Um, I don't know of anything that happens December 15th that would make it a more recognizable deadline. So that's going to be very, very challenging. Certainly, I want to allow other folks to ask questions. Erin, on my team, are there any questions that are in the chat or someone has raised their hand and wants to ask? I don't
Senator,
want
I do
to.
not see any questions in the chat. I don't see that anyone has their hand raised, but of course, anyone, please feel free to ask your question.
Well, folks are formulating questions. I'm assuming. Oh, Tim, go ahead.
Thanks, Art. I just wanted to thank you for putting this all together. I mean, these changes that have been occurring and are going to occur are really problematic in so many ways. Um, uh, I'm a big Penny fan. I know that it really has provided so many people with peace of mind, and that's what we're kind of losing. And I'm coming from Delaware County, where um, we've lost four out of our six hospitals, and just struggling for basic health care for folks anywhere. And one of the things we're seeing is just as a result of losing the four hospitals, there's a whole demographic of people who are just not seeking medical care. And we just, in Delco, that's really a ticking time bomb. We're really not, we have nothing to base on, anticipating what it's really going to mean or how it's going to mean. So uh, we have to. I mean, I know we don't want to get political here, but we do have an election coming up, and that's how we do change things in this country, and that's maybe the only way we have forward to. Because I've certainly heard the $3 billion effect number before. I've also heard up to 10 billion over several years in terms of what it's going to really mean for us from cuts in federal funding. Because most people don't know that a very huge part of our budget is just federal money that comes in through us and then goes out again. So again, thank you for the presenters. It was really Devon and Erin, great to see you again. Thank you very much for being here today.
Thank you. No, thank you so much. And that Delaware County situation, I'm so glad you highlighted it. Um, and certainly it sounds like there was a pinpoint to some rural counties that may be losing a significant amount of coverage as well. Is there anyone who can tell us more about the rural county impact that was described a little bit earlier?
Oh, Devon, you look like you were going to say something. Go ahead.
Yeah, so what we saw is that in rural counties, on average across the state, costs went up double. In some rural counties, the cost for people to stay in their coverage went up by 4 or 5 times. And also because the populations tend to be older, we saw more people sort of above an income cliff where they aren't getting any tax credits anymore. So the example Erin gave, where people go from $500 a month to $2,500 or $3,000 a month, sometimes paying up to 50% of their income towards health insurance premiums alone, forgetting even the deductibles and other costs people pay. We saw examples like that in York County, for example. So those impacts we did see more severely in rural counties. Not to say that urban and suburban were fared much better, but we did see a lot of wide variation, and the numbers show that the impact was worse in rural areas.
Thank you for sharing that. Now, my district is a combination of Philadelphia and Montgomery counties. Do you have information on the impact in those two counties?
Yeah, so we actually have county by county impacts. If you go to our website, pennie.com/affordability, we have information about who has dropped coverage by income level, by age, and by county. So you are able to see down to the county level what the impact has been and how those different populations have fared. Again, we do really see wide variation, and so it really kind of depends on the very unique dynamics of a given area, how many people have been impacted and what the costs are there.
Okay, we'll pull that up. So, what can neighbors do, everyday people who have heard the challenges? Now, what should everyday neighbors do? What's within the control of everyday people? What should be done? Any suggestions?
I think, you all might get mad at me for saying this, but they need to talk to their legislators. I can't stress enough how important personal stories are. Talking to obviously state legislature about how we're going to kind of make up for some of this. One example is a couple of years ago, the state legislature approved a state level insurance subsidy plan. So there is on the books the ability for the state to offer a small subsidy. It won't make up for the enormous, loss of these EPTCs, but there is on the books the ability for the state to offer a small subsidy for folks that are purchasing through the marketplace. It needs to be funded. And I know you all are in budget season right now, so we're hoping that that could be funded this year. That would give people just a little bit of help. So obviously, I'm talking to all the senators and staff, so I'm going to remind you myself, but obviously, neighbors can call their legislators and say, "Hey, I heard that there's a possibility that you guys could help us out a little bit." The other thing they can do is obviously call their members of Congress and call their United States senators and say, "Hey, I'm really getting squeezed by this. My neighbors are getting squeezed by this. Can you reverse this? Could you put these EPTCs back in place? Could you reverse these Medicaid cuts? Could you, work on making things more affordable for folks?" And it is an election year, so I like to think that they listen a little more closely when their jobs are on the line. But I think making sure that we are holding our legislators accountable for the decisions that they are making. So absolutely, people can share your personal stories. I take my kids with me to see legislators all the time because they're the ones being most impacted by this. So don't be afraid to, show up, have those conversations, and make yourself heard.
That's it. We have now hit 11 o'clock. I certainly want to thank both of you, Erin and Devon. Thanks so much for being fantastic presenters, explaining what is often confusing to folks, but also providing new information that many of us were not aware of prior to this conversation. I want to thank everyone who spent the time to join us, all the staff members of other senators, Senators Tim Kearney, and also all the residents who decided that this was an important conversation. For those who are listening, just everyday neighbors, members of different neighborhoods in the fourth Senate district and around the Commonwealth, what you have heard today is a tremendously challenging situation for all of us. Rising healthcare costs and rising uninsured people. And those are both bad combinations for our workforce, for small businesses, just for everyday people trying to maintain their health. We have shed a light on it, but clearly much more needs to be done. One last thing I would encourage you to do on an individual basis is begin to get the paperwork organized so that if you are required to report every 6 months, it's handy and available. My office will try to come up with some kind of toolkit, or there may be a toolkit at FAN already, so that you will have a way to organize this data in a way that gives you the best chance of maintaining coverage. Thank you so much again, everyone, and have a great day.